Hi, this is Dr. Adewale Adeniran at Texas Back Institute. This is Spine Health Awareness Month. Today, we're going to talk about the impact of smoking on your spine health. Is it true that smoking can have a negative effect on your spine health? Unsurprisingly, yes, smoking is bad for your spine. It's been found to accelerate degenerative disc disease in both the neck and the low back. It's been found to increase the progression of some of the conditions that we treat with spine surgery, and it's associated with greater pain and worse surgical outcomes amongst patients who have had spine surgery. Several studies have been done on this subject. What do they say? There's been a broad range of studies on the association of smoking and spine health. The most obvious ones are the ones done on patients who've already had surgery. Smoking affects the outcomes of spine surgery dramatically. Among patients who've had fusion surgery, smoking is associated with a much higher rate of failing to fuse or non-union, which by extension is associated with a higher rate of needing to redo surgery or have a revision surgery. Amongst patients who haven't had spine surgery but have conditions like cervical myelopathy, which is a condition in which your spinal cord is being affected because it's being squeezed, smoking seems to accelerate the progression of that condition, resulting in greater disability than in people who don't smoke. There have been associations with lumbar spinal stenosis and chronic low back pain as well. Genetic studies have been done to try to figure out why is smoking bad for your spine health, and it appears that some of the chemicals found in cigarette smoke affect the cartilage cells on a genetic level to cause them to degenerate faster. Another possible mechanism by which smoking harms your spine health is that it causes blood vessels to constrict. The areas of your disc have very little blood supply, very poor blood supply to start off with, a really diminished way to get nutrients compared to other parts of your body. And smoking, by reducing the blood supply further, seems to affect the disc more than it would affect other organ or tissue systems. Do I recommend my patients to stop smoking? Anytime I have a patient who's a smoker, I recommend that they stop smoking, understanding that is sometimes difficult to do. If someone with back pain stops smoking, how will that be a help to them? Two ways. It is possible that your back pain will get better if you stop smoking, but it's abundantly clear that if you ever needed surgery because of back pain or back issues, having stopped smoking will help you with your recovery and greatly increase the likelihood of success from your surgery. If a patient needs a spine procedure or surgery, does smoking have an impact on the healing process? Yes, smoking affects every part of your healing. Smoking is associated with worse clinical outcomes from the surgery. It's associated with an increased risk of needing revision surgery, an increased risk of failing to fuse in cases where the surgery done is a fusion surgery, and then the medical complications that can arise after a surgery are all higher if you smoke. What is the value of some of the alternatives to smoking for patients who have undergone spine surgery? In my view, the real benefit of the alternatives to smoking, the vapes, the gums, and the patches, is as a bridge to come off nicotine entirely. While cigarette smoke has some unique risks tied to it that these alternatives may help with, the nicotine use itself harms your bones. It reduces the risk of fusing, and it affects surgical outcomes, even if it's ingested in a way that doesn't include smoking. And so I recommend for patients sometimes to transition off smoking to something else, but really only as a bridge towards ultimately being nicotine-free if they're able to achieve that. For more information on how to quit smoking, go to thetruth.com. If you learn anything today, it's that smoking is bad for your spine health.